Hello students. Hello students. Am I audible and visible properly? Am I audible and visible? Hello dear students. Welcome to FMGE Sprint Forensic Medicine and Toxicology. I am Dr. Mnjunatha, Faculty of Forensic Medicine and Toxicology. Forensic medicine is one of the minor subject and it is an important subject asked in your FMGE exam. There will be at least 10 questions from forensic medicine and toxicology in your upcoming exam. Yes. So what are the important topics in FMG concerned? The one important topic is asphyxia. In asphyxia, there are 4 important topics. They are very commonly asked in the exam. The one is hanging, strangulation, suffocation, and very important topic, drowning. Second, postmortem changes. In postmortem changes, rigor mortis, liver mortis, algar mortis, and decomposition is very commonly asked in your exam. Then intracranial hemorrhages and mechanical injuries. Fingerprint, this is last year question. Infamous conduct and medical negligence. Gunshot injuries, this is very important. Very important topic. Blood stain and seminal stain, they are very commonly asked in the exam. Live birth, especially infant death, stillbirth, features of dead born child, and lastly toxicology. In toxicology, important topics are organic irritant, cardiac poisons, cocaine, and datura, and some image based questions. Let me start with the question number 1. Yes, this is the question asked in one of the FMGE exam. The question is, following are the features of ligature mark in case of hanging except. Options are oblique in direction, non-continuous, above the level of thyroid cartilage, base of ligature mark is soft and reddish. So what is the answer? Can you try this? Anyone? Try this. So ligature mark in case of hanging, that is oblique in direction. That is true. In case of hanging, the ligature mark is oblique in direction. It is above the level of thyroid cartilage, and at the site of knot, it is not present. So it is non-continuous. That is also true. Above the level of thyroid cartilage, in 80% of the cases of hanging, ligature mark is above the level of thyroid cartilage. In around 15% of the cases, it is at the level of thyroid cartilage. 5% of the cases, it is below the level of thyroid cartilage. So A is correct, B is correct, C is also correct. Here except is there, then the answer is base of ligature mark is soft and reddish. In case of hanging, ligature mark is a type of pressure abrasion. It is dry, hard, parchmentized. So the answer is D is the wrong statement here. Let me discuss few points about ligature mark in hanging, ligature mark in strangulation. Students, this is very commonly as topic in your exam. In hanging, ligature mark is oblique, non-continuous, above the level of thyroid cartilage, and it is pale, hard and parchment paper like appearance. In case of strangulation, especially in case of ligature strangulation, it is transverse. So ligature mark completely encircles the neck in case of ligature strangulation, and it is continuous. And in most of the cases, in my experience, it is at or below the level of thyroid cartilage. And when you look at the base, when you look at the base of the ligature mark, the ligature mark in case of strangulation, it is soft and reddish. It is all because of the hemorrhages. Hemorrhages. Let me write here. Because of the hemorrhages. The question can be asked in your upcoming exam. Subcutaneous hemorrhages are very commonly seen in. Subcutaneous hemorrhages are base of the ligature mark. When it is soft and reddish, it must be ligature mark of ligature strangulation. So this is very commonly asked in the exam. Now look at this. Dear students, this can be asked in your exam, an image based question. Identify the finding in ante-mortem hanging. Ante-mortem hanging. Is anyone in the group? Yes, ante-mortem hanging means the person was alive at the time of hanging or at the time of strangulation. Here, what you can see here, the one eye is closed, other eye is open. What you can see here, one eye is closed, other eye is open, and pupil is more dilated. So it is because of compression of ligature material over the cervical sympathetic chain. What it is known as? Anyone can answer? What it is known as? Yes, come on. Oh, Mr. Harsha. Yes. Yes. So this is known as lay faces sympathetic. So this can be asked in your exam. It is because of compression of cervical sympathetic chain, because of the knot or because of the ligature material. It is present on the same side of knot. So this can be asked. Same side of the knot. Yes. That's it about the question number 1. Let me discuss about the question number 2. This is very important topic. The question is about the postmortem staining. Cherry red color postmortem staining can be with the which of the following poisoning? Options are nitrate, carbon monoxide, hydrogen cyanide, hydrogen sulfide. Cherry red color. Yes, can answer this? Yes. Your answer should be, that is carbon monoxide poison. In carbon monoxide poison, it is of cherry red color. What is the color in hydrogen sulfide? It must be somewhat green in color. Green in color. Hydrogen cyanide, it can be bright red. and in nitrate it can be reddish brown in color. So the answer is carbon monoxide is the correct answer. Let me discuss few points about postmortem staining. Students, so the postmortem staining is an early postmortem change. When person dies, the blood collects in the dependent area. So here what we can see here, they clearly visible postmortem hypostasis. So this is postmortem hypostasis. And what you can observe here, the margins are well defined margin. A student, in postmortem hypostasis, margins are well defined. In case of contusion, the margins are not well defined. They are not distinct. So that can be asked in your exam. And look at this area. And contact area, when body is in touch with the surface, in contact area, there can be pallor. And what is that known as? Yes, anyone can you guess? What is that known as? So this is known as contact pallor. And in some books it is given, it is also known as contact flattening. Why it occurs? It occurs because of collection of blood in the dependent area after death. It is an early postmortem change. What is normal color? Yes, anyone can you guess what is normal color? The normal color, if the question asked in exam, it answer should be purplish red or purplish blue is the correct answer. Usually it is purplish red is the commonest color of normal postmortem change. Let me discuss what is the color in different poison. Cherry red color. Whenever in exam the question asks cherry red, your answer should be carbon monoxide. Why cherry red? Because of carboxyhemoglobin. Carbon monoxide combines with the hemoglobin, it forms carboxyhemoglobin and that gives rise to cherry red color. Black in color. Can you guess? Black in color. In which condition it is black in color? Your answer should be opium poison. In morphine poison, heroin poison, it can be black in color. And one more point, remember, it can be black in color in advanced stage of decomposition. Deep blue color in carbon dioxide poison. Bright red in case of cyanide poison. All this can be asked in your exam. Cyanide, dear student, cyanide is an ideal suicidal agent. It causes painless death. It can be used in homicide also. So cyanide, the antidote used is, what is the antidote used in cyanide poison? Can you guess? What is the antidote in cyanide poison? Yes, Mr. Harsha, Mr. Sandeep. So in cyanide, the three antidotes are tried. One is amyl nitrate, sodium nitrate, sodium thiosulfate. Amyl nitrate given inhalationally, sodium nitrate and sodium thiosulfate, they are given intravenously through the same cannula. Dark brown in color. In which condition it is dark brown in color? Your answer should be yellow phosphorus. Yellow phosphorus poison. Remember, red phosphorus is non-poisonous. Yellow phosphorus, also known as white phosphorus, it can lead to a clinical condition. What is that clinical condition known as? Anyone can you guess? The clinical condition is Fauci jaw. procedure that can be asked in your exam. And one more point is smoking stool syndrome. Smoking stool syndrome. In patients suffering from yellow phosphorus, there can be fumes coming out from the feces. So because of that, the name is given smoking stool syndrome. Next, bluish green. Can you guess, my dear student? Bluish green, green color, green, bluish green. Your answer should be hydrogen sulfide. Again, hydrogen sulfide is an asphyxiant. It inhibits electron transport chain complex 4. It causes histotoxic hypoxia. It is also known as drainage death. And remember, it is also agent used in Japanese detergent technique of suicide. This can be asked in your upcoming exam. Japanese detergent technique of suicide, where hydrogen sulfide is used. And pink color. The pink postmortem hypostasis that is seen in case of hypothermia. Hypothermia. Hypothermia induced death. It can be pink color postmortem hypostasis. Lastly, chocolate brown or reddish brown that is seen in case of aniline poison. Aniline, nitrite poison. In nitrite poison, it can be reddish brown. So all this can be asked in your upcoming exam. And in the picture, what you can see here, normal postmortem staining, and you can see the contact pallor, well-defined margins. And one more point you must remember, fixation of postmortem staining that occurs between 6 to 12 hours. Fixation. What do you mean by fixation? When you press over the postmortem hypostasis, when there is no blanching, that is known as fixed postmortem staining. Okay, so this can be asked in your exam. Yes, question number 3. Lucid interval is most commonly seen in. Options are subdural hemorrhage, extradural hemorrhage, subarachnoid hemorrhage, intracranial hemorrhage. What is your answer? Can you try this? What is your answer? Lucid interval, it is a period of consciousness between the two periods of unconsciousness. It is classically seen in extradural hemorrhage. So your answer should be extradural hemorrhage. It can be seen in subdural hemorrhage also, but it is very less common. In subarachnoid hemorrhage, lucid interval is not seen. Intracranial hemorrhage, it includes subdural, extradural, subarachnoid. The specific answer for this question should be extradural hemorrhage. Yes. Now, one more point here. Lucid interval also can be seen in. Can you guess what is the other condition in which lucid interval is seen? One more condition is insanity. In mental illness, lucid interval can be seen. During lucid interval, the person can make valid will. Let me discuss some hemorrhages, some image-based question related to hemorrhages. Look at this. What is this intracranial hemorrhage? Can you try this? Yes, you try. Right? So this is what you can see here. So this is the dura mater. So this is the dura mater. This is middle meningeal artery. And here the hemorrhage is above the dura mater. So it must be extradural hemorrhage. EDH. Remember, EDH is unilateral. It usually unilateral, it is limited by suture line. This can be asked in your exam. It is commonly associated with linear fracture of the skull. Linear fracture is also known as fissure fracture. What is the bleeding vessel? Middle meningeal artery. What is the appearance? The appearance is biconvex appearance. Okay, so this is EDH. In EDH, the finding will be lucid interval. Next, look at this. What is this type of hemorrhage? Anyone can you guess? Yes, this is dura mater. Yes, dura mater. And the hemorrhage is below the dura mater. What it is? It must be SDH. So the question can be asked in your exam. What is the bleeding vessel in SDH? Can you guess? Yes, come on. Yes, you are right. It is the bridging veins. Bridging veins. And one more point, SDH usually bilateral. And SDH commonly associated with old age, alcoholism, punch drunk syndrome, taken baby syndrome. Right here, old age, it's very common. Taken baby syndrome, punch drunk syndrome, and alcoholism. This can be asked in your exam. Next, look at this. Anyone identify this hemorrhage? Intracranial hemorrhage, which is visible in the picture. Yes, look at this. So this is base of the brain, where you can see the circle of Willis, where you can see the large hematoma at the base of the brain. What it must be? So, yes, anyone can you guess? So, this must be SAH. SAH. Subarachnoid hemorrhage. It is between the arachnoid matter and the pia mater. The question can be asked, what is the commonest vessel? Your answer should be anterior cerebral artery, or it is anterior part of the circle of Willis. The commonest cause is rupture of berry aneurysm. So when there is a rupture of berry aneurysm, that leads to hematoma at the base of the brain, that leads to subarachnoid hemorrhage. Next, lastly, that is, look at this last hemorrhage, where you can see the brain and inside the brain you can see some hematoma there. What is that? It is the intracerebral hemorrhage. Intracerebral hemorrhage. Basically, there are 4 questions that can be asked from intracranial hemorrhages: EDH, SDH, SAH, and intracerebral hemorrhage. The commonest site of intracerebral hemorrhage is basal ganglia. One of the commonest causes hypertension. So all this can be asked in your upcoming exam. Now look at this question number 4. In case of drowning, dead body showed spasm of group of muscles like this. So some muscles, there is a spasm of the muscle. In which of the following condition primary relaxation is not seen? This can be asked in your exam. Here, the question here, it is about the cadaveric spasm. Cadaveric spasm is also known as cataleptic rigidity. So the answer must be cadaveric spasm. Primary relaxation of all the muscles that do not occur in case of cadaveric spasm. Dear student, let me explain the funda. See, soon after death, Soon after death, all the muscles they undergo relaxation. That is known as primary relaxation. PR, primary relaxation. After that, all the muscles after death undergoes rigor mortis. Rigor mortis, that is a shortening and stiffening of muscle and joint. Later, all the muscle undergo secondary relaxation. So this can be asked in your exam. What is the order of appearance of contraction and relaxation in muscles after death? Primary relaxation, rigor mortis, and secondary relaxation. And remember, this primary relaxation, it is absent in cadaveric spasm. The answer is cadaveric spasm is the correct answer. Heat stiffening. In heat stiffening, there can be coagulation of all the muscle protein and the appearance is known as pugilistic attitude. Cold stiffening, not the answer. Rigor mortis, not the answer. Look at this. So this is classical cadaveric spasm. So whenever in exam, a image is given, a case of drowning with some aquatic matter or the plants in the hand, it must be cadaveric spasm. And remember, dear student, it is the one of the very important sign of ante-mortem drowning. And let me ask you one more question. What is the another name of cadaveric spasm? What is the another name of cadaveric spasm? What is the another name of cadaveric spasm? Anyone can you guess? Anyone? Anyone? Yes. Yes, you are right. It is known as cataleptic rigidity. Cataleptic rigidity. So this is the classical case of drowning. Next, look at this. So this is the classical pugilistic attitude. What you can see here, boxing attitude. This is nothing but heat stiffening. This is heat stiffening. So this can be asked in your exam. Dear student, heat stiffening is antemortem or postmortem? What do you think? Is it an antemortem finding or is it a postmortem finding? Yes, heat stiffening is both antemortem and postmortem finding. It has no medico-legal significance. And the picture that is showing here, this is the rigor mortis. This is how we check for the rigor mortis. What you can see here, the muscles in the contracted state. There is a short stiffening of the muscle and the joint, that is rigor mortis. So answer for this question here is cadaveric spasm is the correct answer. Yes. Now let's go to next question. Now, during crime scene investigation, following fingerprint was found. Identify the type of fingerprint given below. Can you identify? You make out? Yes. So what you can see here, there is a fingerprint here. There is a fingerprint, and what is this fingerprint known as? Fingerprint is also known as dactylography, dermatoglyphics. So it is also known as Galton system. So what is the answer? Yes. Here, what you can see here, entry point, exit point on the same side. So it must be loop. Loop is the correct answer. The answer is loop. The most common fingerprint is loop. Let me discuss few points about fingerprint. Look at this. There are three major types of fingerprint. So this is 1, 2 and 3. So the first one, what we can see here, so it looks like this, somewhat look like this. So this is nothing but arch, nothing but arch. Entry point and exit point on the different side, that is known as arch. And remember, dear students, in arch there is no core and there is no delta. For time being, remember, there is no core, no delta. The core means curving ridge. Delta means three directional meeting point of the fingerprint. The arch, it commonly occurs around 5 to 10% of the cases. 5 to 10% of the second one, what you can see here, so this is nothing but loop. So this is the loop. Loop, remember, entry point and exit point on the same side. And in loop, there is be one core and one delta. One core and one delta. This can be asked in your upcoming FMGE exam. One core, one delta loop. The core means curving ridge. Delta means three directional meeting point. Loop is the most common fingerprint. It's around 60 to 70% of the cases. In 60 to 70% of the cases, loop is the most common fingerprint. The last one, that is the hole. Remember, in hole, you will see one or two circles at the center. One or two circles at the center like this. This is nothing but hole. And in hole, there will be two deltas. And hole, second most common type of fingerprint, it is around 20 to 25% of the cases. So loop, hole and the arch, and the last one is the mixed type, which is also known as composite type. Okay, the most common is loop, the least common is composite. The first fingerprint bureau was started in India in Kolkata by William Herschel and Francis Galton. So this can be asked in your exam. Fingerprint, it can be used in identical twins also. This is asked in your FMGE exam. In identical twins, one of the useful technique of identification, your answer should be dactylography. It is not DNA fingerprinting. Yes, that's about the fingerprint. Now, this question asked in FMG. A doctor sends patient to diagnostic center of MRI. The next day, representative visits the doctor with a letter and money. True about this act is. So here, the question is about doctor is taking commission or he is giving commission. So what is that known as? So your answer should be, yes, my dear students, what is the answer? What is the answer for this question? Yes, try. So it is classically known as dichotomy, also known as T-splitting. T-splitting. Giving commission, taking commission known as dichotomy. Association of some other person, that is known as covering, usually a non-medical person. Covering, this can be asked in your exam. Covering means allowing someone, like usually non-medical person, in treating the patient or during examination of the patient. That is known as covering. It is not criminal negligence. So the answer is A is the correct answer. Let's see here what you must know here. What is infamous conduct? So this is very important topic, dear students. This is asked more than 10 times in your exam. Whenever I talk about infamous conduct, I remember a movie known as Arjun Reddy movie. What is infamous conduct? It is a dishonorable, disgraceful conduct of a doctor during treatment of the patient. It is nothing but, it is a thing which is against the medical ethics. Let's see what are infamous conduct examples. The mnemonic is 6A. 6 A's are there. All starts with the A. A for association with unqualified person. That is known as covering, we discussed. And also it includes dichotomy. Advertisement. Using large signboard or using some advertisement for incurable diseases in media. Adultery. When doctor is involved in some sexual activity with the patient. Illegal abortion, that is nothing but therapeutic abortion. Addiction, when doctor is addicted to some heroin or alcohol and under the influence of alcohol, doctor is treating the patient. So that is infamous conduct. Alcohol. So there are 6 A's are there. All the 6 A's, they are generally examples for infamous conduct. So what is the punishment? What is the punishment for infamous conduct? Anyone can you guess? What is the punishment for infamous conduct? Yes. Yes, come on. Anyone? What is the punishment? The punishment can be either warning from State Medical Council, or it can be removal of name of the doctor from medical register, that is cancellation of license to practice. What is that known as? Professional death sentence. The professional death sentence is given by the question asked in your exam. Your answer should be State Medical Council. Okay. So this is about the question number 6. Question number 7. A gunshot bullet showing tattooing and inverted margin and no signs of burn and charring. What is the range is? What is the range is? Can answer? Yes, come on. Yes, come on. Dr. Shailesh, Farah Ahmad, Shalu Yadav. Yes. Chandani Keshwani, Dr. Shailesh. Yes, come on. Yes, Gaurav Krishna, beta, this is useful in your NEET PG also. Yes, come on. Yes. Try this, beta. So tattooing is there, and patient is showing tattooing, patient is showing inverted margin, and no signs of burns and charring. So what is the answer? Yes, very good. Farah Ahmad, beta, very good answer. It's a very good answer given by Farah Ahmad. Whenever there is a word tattooing is there, your answer should be near shot. So the answer for this question is near shot. Let me discuss what are the 4 ranges. 4 ranges. The first one is the contact range. Second one is the close range. near range and distant range. Let's see what are the features of contact range. Yes, anyone can you guess what are the features of contact range? Yes, come on, come on. What are the features of contact range? Say example, this is a pistol. So this is the contact range. So what are the features of contact range? Anyone can you guess? Yes. So contact range, there will be muzzle imprint, and there will be cruciate shape, cruciate. Yes, cruciate will be there. Whenever it is star shape, cruciate shape like this, it must be a contact shot. Whenever you see some abrasion around the entry wound, that is known as muzzle imprint. So because of the muzzle, so that places over the skull or the skin, that leads to muzzle imprint. Second, close shot. In close shot, the characteristic finding will be blackening. Blackening. Anyone? Why blackening is produced? Anyone? Why blackening is produced? The blackening is because of smoke particle. Next, near shot. In near shot, the finding will be tattooing. And again, question can be asked, what is tattooing? The tattooing is superficial entry wounds around the main entry wound because of unburnt gunpowder. The distant shot, there will be no blackening, no burning, no tattooing, and there will be no singeing of the hair. So only you will see the entry wound, inverted margin, abrasion collar, grease collar, but no burning, no blackening, no tattooing in the distant shot. So this can be asked in your upcoming exam. Just a quick, what you can see here. So this picture, identify this. What is the range? What is the range? Identify this. Farah Ahmad, Malay Patel. Yes, come on. Malay Patel, come on. Parth. Parth. Yes, come on. What is this range? What is this range? Look at this. Look at this image. And what is the range? This is nothing but contact range. Contact range. Second one. So this is the close range. Close range. Close range. The close range means 2.5 to 7.5 centimeter. Near range. In case of near range, you will see tattooing. You will see tattooing. And usual distance must be 30 to 60 centimeter. For example, this is the pistol. This is near range. That is 30 to 60 centimeter, and distance between the pistol and the victim. Okay. Lastly, distant range. This is distant range, and it is more than 60 centimeter. In this, you will see only the abrasion collar, grease collar, inverted margin, no burning, no tattooing, no singeing of the hair. Next, question number 8. Question number 8. Punishment for causing death due to medical negligence given by. This question can be asked in your upcoming exam. So what is the answer? Deepesh Soni, Farah Ahmad. Yes. Punishment for causing death due to medical negligence given by section 304A. So this is the correct answer. The punishment will be 2 years of imprisonment. So medical negligence can be of two types: civil negligence, criminal negligence. The criminal negligence, that is nothing but the gross negligence, punishable under 304A IPC. How to remember? A for apron. A for apron, doctor, medical negligence. What is 304B? What is 304B? Deepesh Soni? Yes, 304B is dowry death. Dowry death. What is 302? Yes, 302, that is nothing but punishment for murder. 302 is the punishment for murder. The murder means guilty mind and the guilty act. 320. 320, that is nothing but grievous hurt. Grievous hurt. Grievous hurt defined under 320 and it is punishable under 325 IPC. The grievous hurt has 8 subclauses like emasculation, permanent privation of sight of either eye. Like that, there are 8 subclauses are there. All these are punishable under 325 IPC. Very good. Good. Deepesh Soni and Farah Ahmad. Very good. So many are answering correctly. Good. Now, look at this question number 8. A dead fetus was found in water. The weight was 45 gram. The length is 25. Length. Length means total length. That is crown to feet length. TFL. Crown to feet length is 25. What is the age? Yes. So for this you must know rule of Hussey. Rule of Hussey. What is rule of Hussey? Up to 5 months. Up to 5 months. It is square root of CFL. After 5 months, it is CFL divided by 5. What is the answer? What is the answer? Try this now. Here it is 25. Square root of 25 is 5. The answer should be 5 months is the correct answer. 5 months. Yes, anyone in the group? Deepesh Soni, Farah Ahmad, Shalu Yadav, yes, Chandani Keshwani, Gaurav Krishna, Parth. What is the center that appears at 5th month of intrauterine life? Anyone? 5th month of intrauterine life. Anyone can you guess? Gaurav Dev. Gaurav Dev. Or 5 to 7 months, the center must be thallus. Thallus is the one which appears at 7th month of intrauterine life. Gaurav Dev. Good. Next. Question number 9. Yes, question number 9. Namaste Gaurav. Namaste Gurjar Dev. Gurjar Dev beta, welcome back. Yes. Look at this. This question is about live birth or stillbirth or deadborn. In autopsy, doctor tied bronchus and checking the floating and sinking of the lung. This test is identified as. What is this test known as? So doctor tied bronchus and he is checking whether it is floating in the water or not. What is this known as? Yes, so this is known as hydrostatic test. So this is positive in case of live birth. Okay, it is hydrostatic test, also known as flotation test, also known as Regot test. Regot test. So the answer is C is the correct answer. But here, what is Gettler test? The Gettler test, it is a test for drowning. So Gettler test is a test for drowning. To differentiate between seawater drowning and freshwater drowning, depending upon chloride ion concentration present in right and left ventricle. So that can be asked in our exam. Getler test, drowning. Marsh test. Anyone can guess? Marsh. Gurjar Dev, Dipesh Soni, Farah Ahmad. Marsh test. The Marsh test, Rains test, Gutsty test, all these are tests for arsenic poison. Arsenic, remember, arsenic is the ideal homicidal agent. It is known as king of all poison. Arsenic poison, you will get a measles line, raindrop pigmentation, red velvety stomach. Gall is used as a treatment. Arsenic is a very, very important topic. You must know. Okay, this is very, very important. Heavy metal poison, you will get at least one or two questions from heavy metal poison like arsenic, lead, mercury, copper, and others. Harrison-Gilroy test. Harrison-Gilroy test, it is the test for gunshot residues, GSR. So, thermal nitrate test, Harrison-Gilroy test, atomic absorption spectrometry, all these are the tests for gunshot residues to detect the gunshot residues over the hands of the victim or the accused person in case of firearm injury. So it is Harrison-Gilroy. So answer is hydrostatic. Now question number 10. A patient was brought to OPD with greenish color skin and rotten egg smell. What is the poisoning? Rotten egg smell is again very commonly asked. Very commonly asked. Look at this. The smell is rotten egg smell and greenish color of the skin. The postmortem hypostasis is green color. So whenever the smell the question asked, your answer should be hydrogen sulfide. This is the correct answer. Remember, hydrogen sulfide, it is inhibits electron transport chain. Electron transport chain. It is also known as drainage gas. It is also used in Japanese detergent technique of suicide. If the question asked in exam, what is the agent used in Japanese detergent technique of suicide? Your answer should be hydrogen sulfide. Garage death, carbon monoxide. Next, what is the smell in? What is the smell in? Now look at this very nice picture, my dear students. Just you need to answer this. Garlic smell. In which condition garlic smell is seen? Anyone can you guess? Garlic smell. Come on. Garlic smell. कहाँ होती है बताओ? In which poisoning garlic smell is seen? Yes. Your answer is arsenic. Arsenic, and also in case of phosphorus poison. In case of phosphorus. Good. Burnt rope smell. Yes, Manish. Burnt rope. Come on. Farah Ahmad, Dipesh Soni. Yes, Gurjar Dev, beta. Burnt rope smell. The burnt rope smell is in case of cannabis. Bitter almond in case of cyanide poison. Shoe polish smell that is seen in case of nitrobenzene. Formaldehyde, acrid smell is seen. Okay. Kerosene like smell, that is also can be asked. Kerosene like smell that is seen in case of OP poison. All this can be asked in your exam. Yes, let's discuss about the question number 11. Come on, all of you try this question number 11. Question number 11, try. A man continues to call females. It is a question about sexual offences. So in sexual offences, you must know rape in detail and unnatural sexual offences and also sexual perversions. Here is one question about sexual perversions. A man continues to call females, achieve sexual gratification by talking obscenity and sharing obscene pictures. This condition is known as, what is this condition known as? So this is a sexual perversion and this is known as catalogia. So the answer should be catalogia. You must know what is sadism, masochism, bondage, voyeurism, pratyurism, undinism, uranism. All this you must know. What is satyriasis? What is satyriasis? Anyone? Dipesoni and others? What is satyriasis, nymphomania? Satyriasis or nymphomania, they are related to excessive sexual desire, excessive sexual drive. In case of males, in females, it is known as nymphomania. Stalking. What is stalking? Stalking means पीछा करना, follow करना. So a female being followed by a male repeatedly with a clear indication of disinterest, that is known as stalking. The stalking is punishable under 354D IPC. 354D IPC. Yes. Anyone stalking by a female, is it a punishable offense? Can you guess? Parama, Deepesoni and others. Yes, yes. Come on. Stalking. Stalking by a female following a male repeatedly with a clear indication of disinterest. Is it a punishable offense or not? Yes, yes. Paramad. No. It is no is the one. Remember, it is limited only to females. It is limited only to males. It is clearly given in definition. Man said to. It is clearly given. That's why it is only females. Voyeurism. What is voyeurism? Voyeurism is also known as peeping Tom. Taking image, taking video of the female while changing dress, while using bathroom or toilet, or in malls, or in dressing room in malls, cloth shops. So that is punishable under 354C IPC. 354C IPC. This can be asked in your exam. Yes. So okay. Yes, Deepesh Soni is telling बस लड़कों के साथ ही होता. Okay, fine, चलो. So all of you once again, scatologia, okay, satyriasis is done, stalking, voyeurism, all discussed. Now look at this now. This is a nice picture, my dear students, and this is one of the hit movie in Bollywood. Name is Drishyam movie, and where the villain he takes the image or the video of the girl secretly. What is that known as? What is that known as? And it is a punishable under 354C IPC. Have you seen this movie? Yes, students. Deepesh Soni. Yes. Voyeurism. This movie based on voyeurism actually. Fine. Okay. Next, come on. Look at this question. Rigor mortis occurs first in. Rigor mortis means shortening and stiffening of the muscle and joint. It first occurs in. That is the question asked. Come on, anyone? Yes, your answer should be myocardium. So rigor mortis, the first occurs in myocardium. That is the correct answer. Then is the eyelids. Then the face, and so on. Lastly, fingers and toes. What is this rule known as? Anyone? What is this rule known as? Yes, this rule is known as Nisten rule. So rigor mortis involves voluntary muscle and involuntary muscle. The first involuntary muscle, myocardium. First voluntary muscle, your answer should be eyelids. Last muscle, fingers and toes is the correct answer. So there is a proximo-distal progression, and this order of appearance and disappearance is known as Niston rule. And one more rule you must know, Shapiro rule. Shapiro rule, that is proximo-distal progression. And one more rule you should know, that is the rule of 12. Rule of 12. Rigor mortis appears in 12 hours, maintained for about 12 hours, disappears in 12 hours. That is known as rule of 12. Any one rule that can be asked in your exam. And remember, rigor mortis because of depletion of ATP. Depletion of ATP. So when ATP is not there, there is no separation of actin and myosin, and muscles will be in the contracted state. So depletion of ATP, that is the correct answer for pathogenesis of rigor mortis. So what you can see here, rigor mortis, Niston rule, heart in 1 hour, then eyelids is around 3 to 4 hours. Just summary, neck and lower jaw. Next is the face, around 4 to 5 hours. Chest, upper limbs, abdomen, lower limb, lastly fingers and toes. So this rule is known as Niston rule. Niston rule is the correct answer. So Faraz Patel, welcome. Deepesh Soni, yes. Now what is the differential diagnosis of rigor mortis? Very commonly asked. There are 4 differential diagnoses of rigor mortis. One is cadaveric spasm, CS, cataleptic rigidity, that we discussed already in the beginning. Second, heat stiffening, HS, also known as pugilistic attitude. Third one, cold stiffening. Cold stiffening because of the freezing temperature, muscle coagulation occurs. Muscle protein undergo coagulation. Last one, gas stiffening, GS. There are 4 conditions. They are differential diagnosis of rigor mortis: cadaveric spasm, heat stiffening, cold stiffening, and the gas stiffening. Gas stiffening because of putrefaction. Yes, come on. Now look at this question number 13. All of you try this now. Try this. Come on. A 5-year-old child with a history of perianal pain. So this is about a case of sexual assault in a child. Okay, in a child. So this must be a case of POXO. This must be a case of POXO. What is POXO? POXO means protection of children from sexual offences. So this must be a case of penetrative sexual assault. So here there is a history of penetration. So PSA. What is PSA? Penetrative sexual assault. On subjecting the specimen from the perianal region, it produces yellow needle crystals of spermine picrate. This is the picture that shows needle shaped crystals. This is very commonly asked in the exam. So dear students, whenever question is given, yellow needle shaped crystals of spermine picrate, picric acid word is there. So picric acid is a reagent that is used in Barberio test. The answer should be Barberio test is the correct answer. Barberio test, Florence test, they are all the tests for seminal stain. Whenever you see yellow needle shaped crystals, your answer should be, that is Barberio test. In Florence test, you will see dark brown rhombic crystals. Rhombic crystals. Upcoming exam, seminal stain, brown rhombic crystals are seen. Florence test is the correct. Takayama and Teichmann test. What are the 2 tests? Bramah, Paras Patel, Deepesh Soni. What are these two tests? Takayama and Teekman test. Anyone can you guess? Anyone can you guess? Anyone can you guess? Takayama and Teekman test. Yes. Call me by your name. Takayama and Teekman test. They're basically for blood stain. Blood stain. These two are very commonly asked. They're basically confirmatory tests for blood stain. Let me discuss few points about Takayama and Teekman. So there are four tests for blood. There are four tests for the blood. What are the four tests? Takayama test, Teekman test, Wegener test. One more is spectroscopic examination. Spectroscopic examination. In Teekman test, there will be formation of brown rhombic crystals. This is very important topic. Very important topic. You must know in detail about it. Okay. Teekman test, brown rhombic crystals are seen. In Takayama test, the crystal is pink feathery crystals. Pink feathery. How to remember Takayama? So you can remember Mama. So that is Mama is pink in color. Some mnemonic, some association. Yama, Mama, pink feathery crystals. Wegener test, there will be again brown multi-shaped crystals. Brown multi-shaped crystals. This is very commonly asked in the exam. You need to know the shape of the crystal formed during investigation. Teekman test, brown rhombic. Takayama test, pink feathery. Wegener test, brown multicolored or multi-shaped crystals are seen. Spectroscopic examination, that is the best test. What is the best test for the blood stain? Your answer should be spectroscopic examination. Okay, best. Okay, now this is about the question 13. All clear? Deepesh Soni, Farah Ahmed, any doubt in this? Any doubt? Any doubt? Any doubt in this? Come on. Say yes in the group. Say yes in the group so I can go to next question. Say yes, come on. Come on. Yeah. Next question. Next question is about the authentication centers. Okay. So here is the question. And the question is, a child who is a victim under POCSO Act brought to Department of Forensic Medicine for age estimation. This is a common procedure we do in forensic medicine. X-ray of the image of the hand is shown below. What is the likely age of the child? Likely age. So what you can see here, there are many carpal bones are there. There is a formation of capitate, hamate, triquetral, trapezium. So most of the centers appear except pisiform. Pisiform is not there. Okay. Pisiform is not there. Not there. That means it is less than 11 years. Less than 11 years. That is the one clue what you can see here. Next. Second thing, what you can see here, radius and ulna. What you can see here, radius and ulna, they are not fused. That means less than 18 years. So here the best answer is 7 to 8 years is the correct answer. 21, 22 is wrong. 18, 19 is wrong because ulna and radius, what you can see, the clear gap is seen. Whenever you see clear gap, so that means it is not ossified. That means it is less than 18 years and more than around 9 years. So usually it is 7 to 8 years is the correct answer. What you must know in this, all of you, carpal bones, the carpal bone, there are 8 carpal bones are there. You must be knowing the mnemonic, she looks too pretty, try to catch her. Capitate is first to ossify, that is around 2 months of age. So what we can see here, so this is the capitate. This is the capitate. Hamate, that also appears at 2 months. So this is the hamate. Hamate. So capitate, hamate, almost same age group as around 2 months. Triquetral, you can remember triquetral, that is tri word is there, it must be 3, that is 3 years of age. 3 years of age. Lunate, lunate is a moon shaped carpal bone, that is around 4 years. How to remember? Moon, M-O-O-N, there are 4 alphabets are there, that is moon. Scaphoid, scaphoid, remember scaphoid is a board shaped carpal bone. S is there, S looks like 5, scaphoid is 5 years. Trapezium trapezoid is around 6 years. 6 years. And the physiform, I remember this as a lazy form, that means last to appear, it's around 9 to 11 years of age. So remember, carpal bone, they appears only, they never fuse. Never fuse. And remember, lower end of the radius, that fuses at 2 years. Lower end of radius appears at 2 years, fuses at 18 years. Lower end of ulna, that appears at 4 to 5 years, fuses at 18 years. So this is very important table, you must know in upcoming exam. Next, look at this now. What is the age of this X-ray? What is the age of this X-ray? Come on. Yes, who can try this? Yes, come on. Yes, see here, capitate is there. Capitate appeared. Hamate also appeared. Triquetral also there. Pisiform is also there. Pisiform is there. Appeared. Pisiform is also appeared here. That means it is more than 9 years. More than 9 years. Lower end of radius. Lower end of ulna. Radius and ulna, they are fused. That means it is X-ray of 18 years. It is the X-ray of more than 18 years is the correct answer. What is the answer? More than 18 is the correct answer. Now, question number 15. So, the question number 15 is about heat stroke. All of you look at the question, try to answer. Try to answer. Look at the question, try to answer this. Try to answer. A man was working in a field. He suddenly collapsed on a hot summer afternoon. On examination, there were no physical signs of dehydration. His serum electrolytes level was normal. The doctor found that body temperature was 106 degree Fahrenheit. Which of the following least likely present? Least likely present. What is the answer? Hot skin, that is commonly seen. Hypotension, that is also commonly seen. Disorientation, that is also seen. What is not seen or which is the least common, your answer should be sweating is correct because sweating is almost absent. Sweating is absent. So answer is C is the correct answer. So it is a case of heat stroke and there is a failure of hypothalamus mechanism to control the body temperature. When there is a failure when body exposed to high degree of heat, so sweating will be absent. So answer is C is the correct answer. While recording evidence in the court of law, question number 16. The lawyer asked the witness, did A kill B in your presence? The witness said yes. So it is the case of eyewitness and the question asked was leading question. This type of question would be permitted in which of the procedural route in the court of law? Question is very simple. Leading questions are asked in which part of the courtroom procedure? Very simple. All of you try this now. Try. Try. Your answer should be cross-examination. Okay. In cross-examination, leading questions are permitted. Leading question means straightforward question or yes or no questions, or the question which has an answer in it. They are permitted only in case of cross-examination. The answer is C is the correct answer. C is the correct answer. Now, dear students, this is very important topic. Let me discuss courtroom procedure with a picture. Here, look at this. Let me explain this courtroom procedure with a picture from a very famous movie of Akshay Kumar. What you can see here, you can see the two advocates here. For example, he is the defense lawyer. He is the defense lawyer and he is the public prosecutor. And one more here is the judge. So we are talking about courtroom procedure, and in courtroom procedure there are basically 5 steps are there. In general there are 5 steps. What is the first step? What is the first step? Anyone? What is the first step? Anyone can answer? First step in courtroom procedure is the oath. Shapath is the first step. That comes under 51 IPC. Second step, examination in chief. In examination in chief, public prosecutor is going to examine the witness. He is going to explain the facts of the case to the court. That is known as examination in chief. And in examination in chief, leading questions are not allowed. But there is one condition where leading question can be asked. That is in case of hostile witness. This you must know, you must remember, my dear students. Hostile witness. What is hostile witness? Anyone? Hostile witness. Anyone? What is hostile witness? In the group, come on. Farah Ahmad, Paras Patel, Deepesh Soni. So, hostile witness is a U-turn witness or one who changing his statement during courtroom procedure. So, next, cross-examination. Cross-examination usually by defense lawyer or defense counsel, where leading questions are permitted. There is no time limit. No time limit. And it comes under section 141 to 146 Indian Evidence Act. Re-examination. Next step is re-examination. Once cross-examination over, again public prosecutor, he examined the witness, he asked some questions, that is known as re-examination. Again, leading questions are not permitted. Comes under 137 to 138 Indian Evidence Act. Lastly, court or judge questions. Court or judge, you can ask question at any time of the trial. So all these are the 5 steps of courtroom procedure. Oath, examination chief, cross-examination, re-examination, lastly the judge question. And one very important question you must know here is the perjury. This is very commonly asked in your FMGE. What is perjury? The perjury means giving false evidence in court of law under oath. It is defined under section 191, punishable under section 193. 191 IPC and 193 IPC, both can be asked in your exam. Now, type of hymen given in the image. Look at this. Try to answer. Try to answer this question. Try to answer now. Try to answer. Type of hymen given in the image. So what you can see here, this is about question about the virginity. and sexual offences or sexual jurisprudence. So what you can see here, two openings are there. So it must be septate hymen. In Cubriform, there will be multiple openings. Like this. Fimbriated, there will be notches. There will be no. The most common type is semilunar. This can be asked in your exam. In which section of IPC deals with punishment of perjury? Already we discussed. Yes, come on, try this, try this. This is deals with perjury. Punishment means 193 IPC. Definition that comes under 191. 197 giving false certificate. Giving false certificate, that is 197. And the punishment is 7 years of imprisonment. This can be asked in your exam. 191 definition of perjury. 193 punishment for perjury. 197 giving false certificate. 192 fabricating evidence or fabricating false evidence. So that is known as 192. Question number 19. This is about the autopsy. Which of the following commonly used for preservation of viscera in toxicology autopsy? Can you try this, all of you? Try this, try. So viscera in autopsy, what is the preservative that is used? So we normally preserve liver, intestine, part of the liver, part of the kidney. So what is the common preservative that we use? Yes. So you are right, Dipasonic, saturated salt solution. Very good answer. Saturated salt. Paraffin, that is used when there is some viral specimen is there. Specimen contain some virus. For example, COVID-19 virus, HIV virus. In that, paraffin is used. Rectified spirit, one of the best preservative. Formalin, that is used in histopathology. Histopathology. Now look at this. This is how we preserve viscera in toxicology. What you can see here in picture, so Dr. V.K. Lokes and Dr. Dipesh Soni, there are 4 boxes you can see there. 4 boxes are there. So this is the 1 and the 2, 3 and the 4. What are these? Anyone can identify? What are these? Anyone? If you answer, let's see now who is going to answer. There are 4 viscera specimens were collected during toxicology. What are these 4 dabba they contain? 4 dabbas, what they contain? The first one that contain stomach and intestine. That is nothing but small intestine. It's around 20 to 30 centimeter. There is usually duodenum. The second that contains liver and also the kidney. The third that contains blood. Fourth contain that is urine. And also along with this, you need to preserve a sample of preservative also, that is the saturated solution of common salt. And remember, all this, the best agent is rectified spirit. Rectified spirit. But commonly we use NaCl solution. NaCl solution. And also in autopsy, dear student, you must know skin incision, I incision, Y incision, modified by X-shaped incision, all inverted Y-shaped incision. And also you must know techniques of autopsy. Gone technique, Letule technique, okay, Rokitansky technique, Virchow technique. All these techniques also you must know that is very commonly asked in FMG. Next, question number 20. This is about the tattoo. Okay. Now try all of you. Try this question number 20. Try question number 20. Can you try? A deceased male was brought to mortuary for post-mortem examination. Relatives reported that he had a tattoo over his skin, which was not found on examination, probably because of the decomposition or because of the skin slippage. Which of the following structure would you examine? So this is about the tattoo. So very simple it is. Whenever question is asked about the tattoo, your answer should be that is lymph node is the correct answer. Lymph node is the correct answer. Not the liver, not the arteries, not the skin. Skin can be preserved in case of firearm injury. Okay. Liver is normally preserved in toxicological analysis. Lymph node is the correct answer. Now, last 5-10 minutes, let's discuss few image-based questions that can be asked from toxicology. Any doubt in this? You can ask me. Any doubt? Dear students, any doubt? You can ask me. Yes. BBQ. Yes, all of you now interact with me. Look at this. There is a plant given to you in exam, and the plant, the fruit that contain, some spiny projections are there. Spiny projections are there. So what is this plant known as? Right? Dr. VK, Dr. Deepesh Soni, Farah Ahmad, and I'm going to explain you. This plant leads to delirium. This leads to 9D manifestation. It consists of hyoscine, hyoscyamine, and traces of atropine. It causes muttering delirium. So what is this plant? Just tell me. So what is this plant known as? Come on. Who is going to answer? Let's see. Yes, so this is nothing but your Datura plant. Datura is very commonly asked. You must know. Datura is a deliriant. It causes 9D manifestation. What is the active principle of this Datura plant or Datura seeds? Hyoscine, hyoscyamine, and atropine. Treatment will be physostigmine. This can be asked in your exam. Okay. And one more point here I'm going to discuss here. The seeds are kidney shaped. The fatal dosage is 75 to 100 seeds. 75 to 100 seeds. It is used as a road poison. It is used in robbery. It is used in kidnapping. So sometime in sexual assault or in kidnapping child also. So this is Datura. Datura is a very commonly asked topic in your FMGE exam. You must know in and out of the Datura. So Datura is also known as thorn apple because of the spiny projection over it. It contains multiple seeds. Fatal dosage around 100 seeds. Treatment of choice, that is physostigmine. Now look at this. Look at this plant. Now here I am giving a plant and also the seeds of that plant. The plant is known as, and what is the seeds known as? It is a type of organic irritant. Anyone can you guess? So this is castor plant. Remember, in castor plant, the fruits, they appear in clusters. In case of Datura, the fruit they occur single. So, and the seeds are look like common tick appearance. What you can see here, brown and black markings are there. This must be seeds of resinous communis. Okay. Okay. This is known as resinous communis. क्या बोलते हैं इसको? Resinous communis. Resinous communis. What is the active principle? Resin. What this resin will do? Resin, it inhibits protein synthesis. It inhibits RNA polymerase. It inhibits protein synthesis. It causes death within 3 to 4 days. 3 to 4 days. And dear students, remember one very famous case of this poisoning is umbrella murder case. Umbrella murder case. Good answer, Dr. VK. VK is telling the fatal dosage is around 5 to 10 seeds. You are right. The fatal dosage is 5 to 10 seeds. Fatal period 3 to 4 days. And also remember, these seeds are an agent of bioterrorism. Bioterrorism. So it's an organic irritant. Organic irritant. Look at this. So this is how the resinous communis seeds look. They look like a common tick appearance. They're very small. They have brown and black markings are there. So this is the resinous communis. So next, look at this. Anyone look at this? Try this. Try. Dr. VK, Dr. Deepa, Beta Deepa, answer this. There are some seeds are there. It looks like a circular seeds are there. Circular with a central depression is there. So and this causes tetanus-like picture. It causes rhizus sardonicus, opisthotonus, pleurostotonus, and it is also used in killing of dogs. It is a spinal poison. I'm giving you so many clues now. So many clues. What is the answer? What is the answer for this? Yes, come on, Deepa. Yes, so these are nothing but seeds of Nux vomica. What these seeds contain? They contain strychnine. What is strychnine? It is a spinal poison, acts on spinal cord, inhibits glycine. It causes tetanus-like picture. Treatment. The treatment will be barbiturate. What is the fatal dosage? 1 seed. Fatal dosage is 1 seed. Now look at this question number 24. Yes, 24. There are 2 seeds are given to you. Both are very commonly asked in toxicology. The 1 seed that is black and red color, that is used as a cattle poison. What is that? A and B. This is used as a cattle poison. And the B, they are heart-shaped seeds are there. And these heart-shaped seeds are used by laundry person to put mark on the cloth. Both are organic irritant. Both are poisonous. What are these seeds known as? Very good. So Dr. VK, so this is nothing but rati seeds. Rati seeds. It contain abrus or abralin. The plant name is Abrus precatorius, which is a well-known cattle poison. Okay, and B, that is Semicarpus anacardium, which is nothing but marking nut. Marking nut. They are heart-shaped. They have a projection at the base. They are black in color. They are used in abortion. They are also used in artificial bruise. Let me write here A and AB. A for abortion, AB for artificial bruise. That is the medico-legal significance of semicarpus anacardium. Next, 25. 25, look at this common plant. This is used in abortion. This is used in abortion, used in artificial bruise, used in infanticide. What is this plant? What is this plant? Anyone? Anyone? What are these two plants known as? Come on, anyone? Come on. Yes, yes, yes. So one plant has white flowers, other plant has a pink flowers. Both are of the same name. So this is your plant, Calotropis. Calotropis. White color, Calotropis procera. Pink color, Calotropis gigantica. Active principle is calotropin or calatoxin. Now look at this. Question number 26. The nice image. Again, very important topic in your toxicology. This poison leads to coma. Leads to coma. Pinpoint pupil. Pinpoint pupil and respiratory depression. What is this plant known as? Yes, what is this plant? Coma, pinpoint pupil, respiratory depression in toxicology. It is a triad of. It's a triad of. Sapna Sharma, you are right. So this is nothing but the plant of opium, Papaver somniferum. So this is poppy plant. Poppy plant, and one which is visible here is the poppy seeds. Poppy seeds. Here students, poppy seeds, are they poisonous or not poisonous? Yes, come on, anyone? BK Vlogs, Sapna Sharma, Radhe Krishna, Deepa, come on, Deepa Shri, Paras Patel, Para Ahmad. My question is, are they poisonous or not? Your answer should be, they are not poisonous. They are not poisonous. Very good. Now this is a nice picture. This is the preparation of cannabis. There are 5 pictures given to you. They are all pictures of cannabis. Cannabis is nothing but Indian hemp. So there are 5 pictures are there. The topmost picture, this is the bang. Bang. And this is the charas. This is the ganja. This is mazoon. And this is the hashish oil. Hashish oil. There are 5 preparations of cannabis. What are they? Bang, ganja, charas, mazoon and hashish oil. The active principle is 9-tetrahydrocannabinol. My dear students, chronic intake of cannabis that leads to a impulse disorder. What is that impulse disorder known as? Anyone? Anyone? What is that impulse disorder known as? Those who are taking ganja for a long time, they develop an impulse disorder, impulse of killing people, impulse of murder. What is that known as? Let's see, this is asked in your exam. Yes, come on. So this is known as run amok. This is asked in your exam. Run amok. So go through in detail about cannabis. That is very commonly asked. Cocaine, cannabis, datura, they are very commonly asked. Then look at this. There are 2 cardiac poisons are there. There are 2 cardiac poisons. This can be asked in your exam. Very famous 2 cardiac poison. One is the aconite. So this is the aconite root. And this is yellow oleander. Yellow oleander. Both are cardiac poison. In fact, aconite is known as queen of all poisons. It is one of the ideal homicidal agent. So it causes bradyarrhythmias and death. So aconite, oleander, digitalis, digoxin, all these are cardiac poison. So and remember in aconite there will be one very important finding that is known as hippus. Hippus can be asked in your exam. The alternate constriction and dilation of the pupil that is known as hippus that is commonly seen in case of aconite poison. There can be salivation, hippus, tingling numbness sensation, first degree heart block, bradyarrhythmias and death in case of aconite poison. Oleander can be yellow oleander or it can be pink oleander also. Nerium odorum, Cerebra thivacea, they are the plant name of oleander. Question number 29. Who can identify this? Come on, try this. Last 2 minutes, my dear students. Last 2 minutes. There are two images, 29 and 30. Look at this image. Patient is having multiple osteomyelitis. Osteomyelitis like picture. So what you can see here, pus formation. Pus formation. And what is this condition in toxicology known as? Yes, what is this condition known as in toxicology? So this is known as Forsythia. Forsythia, and the agent is yellow phosphorus. Yellow phosphorus. Remember, red phosphorus is non-poisonous, only yellow phosphorus is poisonous. It leads to a syndrome known as smoking stool syndrome. And the postmortem hypostasis is dark brown in color. All this can be asked in your exam. The last question, question number 30. Yes, hydrostatic test and Ploquet test, Dr. V will explain. Yes, last one. Look at this last poison. Last and but not the least, there is a snake which has a third supralabial which touches the both eye and nostril. What is this poison? What is this? What is this snake? Poisonous snake. So third supralabial touches eye and nostril. What you can see here, this is the third supralabial. It touches the eye as well as the nostril, which is a common snake in India. It is a feature of dash snake. Come on, Dr. VK. Dr. VK and others. VK and others. Yes, yes, come on. Yes. So this must be common cobra. This must be common cobra. Very good, Dr. VK. Common cobra is a neurotoxic snake. Neurotoxic snake. So this is about the common cobra. Common cobra, remember, neurotoxic. The earliest finding will be ptosis. Ptosis. And here, what you must know, there are 4 important snakes in India. They are known as big 4 snakes. What are big 4 snakes? Common cobra, common krait, Russell's viper, and saw-scaled viper. And the treatment of all big 4 are big 4 snake, anti-snake venom. Anti-snake venom. And one more point you must know, cobra causes neurotoxicity, vipers they cause hemotoxicity. So all this can be asked in your exam, types of snake, treatment of snake bite, all these are very commonly asked in your FMGE exam, go through that. Okay, so that's it about the this FMGE sprint. So I try to cover almost all important topic in 1.5 hours. Also some 10 images in between at the end. So if you have any doubt, you can ask in Telegram group. or in the Telegram group of PW MedED. And also there are some multiple tests also there that you can try. FMGE mock test also they're available in the app, that also you can try. So with this, now I'll end the class. Thank you so much. You cannot change your future, but you can change your habits. Surely your habits will change your future. So that's what at the end I can say. Wish you all the best for your upcoming exam and good luck.